Hi, everybody. This is Dr. Meaghan with One Agora Integrative Health. I wanted to come on and answer some common questions that we're getting about antibody testing. We've been doing testing in our office now for about 4 weeks. We've really found some interesting information out from it, but we've also gotten a lot of questions now about our testing, how it's different from the other testing out there, and whether or not people should be doing this kind of testing. These are all great questions and ones that I really want to answer honestly and with information by going through the testing. So I wanted to take a second and show you how our test differs from the others out there. These are test results for actual patients with obviously their identity hidden. But this is where I want to show you why we've used Vibrant America for our testing is because they're testing 4 parts of the antigen. So the antigen is the actual virus. And when we look at SARS-CoV-2 or COVID-19, what we're doing here is we're looking at 4 pretty prevalent parts of the virus protein. So we get 2 spike glycoproteins, S1 and S2, which that helps us to determine whether or not this is a true COVID-19, but can also get some false positives on this if you've had possible exposure to some other coronavirus in the past, which also then means that there's a pretty strong likelihood if you have been exposed to like coronaviruses that you might have some immunity also to COVID-19. But we're looking at 2 spike glycoproteins, so S1 and S2. Then we're looking at this receptor binding domain. This is the protein that actually goes in and binds with the human cells. So when we talk about the binding of this virus to get into the human body, this is the protein that we use for COVID-19. And then the nuclear protein, which is the actual DNA, RNA, genetic protein part that makes COVID-19 what it is. Most antibody testing that they're talking about out there and the ones that they're doing now to look for it are going to look mainly for one or both of either just the receptor binding domain, because this is a very specific protein that binds to get into the cell for COVID-19, or this nuclear protein. And some are testing one, some are testing both, but you'll see that not very many are doing a full 4 protein antigen profile like we're doing in our office. Then what's happening is it's looking at 3 immune responses that we can have in our body. By far, the majority of antibody testing will do Igm and IgG. Because of the way the immune system works, Igm means an acute infection or something that's happened recently, probably within the last week. It's also the time when you're probably most likely the most contagious because your immune system is just starting to have a reaction. And IgG responses are what we see when there's been exposure in the past. And this usually takes at least about 15 days to start to develop some IgG antibodies to an infection. Now, Vibrant America has added in a 3rd immune response that you don't see on, I think, any other test, but for sure the majority of them out there. And the reason they put in IgA for COVID-19 is, for full transparency, we don't really know what role this plays in long-term immunity. But because of the fact that COVID-19 and the coronavirus is an upper respiratory infection that really goes after a part of the lungs called the alveoli that are very mucous membrane based, IgA is going to become elevated in any kind of mucous membrane kind of infection. And so by looking at these 3 parts of the infection in a time when we are still gathering a lot of facts and don't really know fully what it means to have an immune response and what that means long term, Vibrant America did a really good job of saying, let's be as comprehensive as possible in order to really get as much information in the big picture of all of this. And so that's why I really like that they do all 3 parts of this immune system, along with looking at these 4 different parts of COVID-19 or the antigen. Now, to break this down, what happens is that there are some places that would just check IgG just to see if there's immunity and long-term exposure, and some would just check IgM to see if you're having any of an acute infection. And then because of that, if we're just looking at one of this component of it, we could possibly miss some positive exposure or people that have been exposed or were more recently exposed and just not developing antibodies like we would expect. So that's why I really do like this test that we're offering and really able to gather as much information as possible as we sort of piece this together, not for just individuals that come into the office, but also as we look at the big picture. So this just shows you then this person's negative. So That sort of lets us believe that there have been no exposure because there's no acute antibody numbers up, there's no long term, and then there's no mucous membrane or sort of that lung and upper respiratory response. This is a good example then of somebody that has been exposed to COVID-19 somewhere in the past where they no longer are having an acute response. So they're negative in their IgM. They're no longer having a mucosal membrane response and they're negative in their IgA, but they've now built up those antibodies, IgG, which means that they're also then going to have a kind of immune response in the future if they see any of these parts of the protein where they're able to go after it faster and have more of a quicker response and immunity. This is also a great example of somebody who, as we talk more about plasma donating and providing IgG and immunity for people through other people's plasma, this person would be a great person to consider donating their plasma to help build up the immunity of other people. The question I'm getting a lot is, should I do antibody testing? And I think going through this and sort of letting you see the information that we get and explaining how it's different than some of the other places, my honest answer is if you're wondering if you were exposed, if you think you're exposed, then our testing by far is the most comprehensive and it'll give you these answers. And so those are the people that I would say individually, if you want to know where you are a great, great, great candidate for antibody testing. Antibody testing is becoming more prevalent out there. There is talk too with a lot of places wanting to, and a lot of states wanting to go and get more information and provide more antibody testing. And those probably will be covered by either insurance or the government funding and things like that. So it's not a bad idea to sort of let the next couple weeks or months unfold to see what is offered, especially if it's a little bit less expensive. But if you are looking for a really comprehensive test, if you're looking to really know if you've been exposed recently or in the past and want that information now, this is a great test to consider.